In this lab, you will do two related experiments. First, you will measure the level of hemoglobin in a blood sample using a hemoglobinometer. Second, you will determine the percentage of red blood cells in a blood sample using the Hematroc technique. Both experiments will use animal blood, which is safe. However, in this lab, we will follow precautions used for working with real blood, as we are simulating real-life conditions. According to these precautions, you will wear gloves at all times when handling the blood. Disinfect the benchtop and any other surfaces or equipment that might have been exposed to the blood, both before and after performing the procedures. Dispose of all materials that have been exposed to the blood in the biohazard waste container. Before you apply the blood sample, you must first turn on the hemoglobinometer and insert the test card. Wait for the flashing drop symbol. Using a micropipetter, apply 12 microliters of blood over the center hole of the test card. If you are unfamiliar with how to use a micropipetter, please consult with your lab instructor. The hemoglobinometer will display a countdown while the blood is being analyzed. The result will be displayed on the screen in grams per deciliter. The blood you will analyze is animal blood, so the experimental values will be lower than normal human values. The display reads low. This indicates that the result is less than 6 grams per deciliter. If the display reads high, this indicates that the result is greater than 21 grams per deciliter. If an error message appears, please consult with your lab instructor. The meter will automatically turn off after 2 minutes. Discard all the materials in the biohazard waste container, including the pipette tips and test cards. When you are finished, be sure to wipe the work area with disinfectant. During the lab, follow the directions in LabTutor and ask your lab instructor if you have any questions. The hematocrit, or packed red blood cell volume, determines what portion of a blood sample is composed of red blood cells. Blood is collected in a special capillary tube and spun in a centrifuge, which separates the blood into 2 layers based on the density differences between the plasma and the formed elements. To start, gently mix the blood sample by swirling the bottle. This will ensure that the formed elements of the blood are resuspended evenly in the plasma. Place one end of the capillary tube into the blood sample. The blood will be drawn into the tube by capillary action. The tube will fill faster if the open end of the tube is slightly lower than the blood source. Draw up the blood until the tube is approximately 2/3 full. Place one finger over the open end of the tube and wipe the outside of the tube with a Kim wipe. Press the end of the tube that is filled with blood into the sealing clay. Place the tubes into the special holder in the rotor of the centrifuge. There are 2 critical things to remember before you spin the blood. Be sure the sealed ends of the tubes are oriented towards the outside of the centrifuge and not towards the center spindle. It is critical to balance the tubes in the centrifuge. Take a look at these tubes. Are they balanced? You can see that one side of the rotor is overloaded and therefore the tubes are not balanced. This imbalance can be corrected by moving one of the tubes to the position directly across the rotor from the other tube. Now, these tubes are balanced. Your TA will check that the tubes are properly balanced and start the centrifuge. Centrifuge the tubes for 3 minutes and wait until the centrifuge rotor has completely stopped before lifting the lid. Remove the tube from the centrifuge and measure the total height of the blood column in the tube and the height of the packed red blood cells. Divide the height of the packed red cell layer by the total height of the blood column to determine the hematocrit. For example, in this tube, divide 5 mm by 61 mm to calculate a hematocrit of 8.2. Remember, you'll be working with animal blood, so the experimental values may be different than human values. Discard all the materials in the biohazard waste container, including the capillary tubes and Kim wipes. When you are finished, be sure to wipe up the work area with disinfectant.